Okay, well, good afternoon, everybody, and happy tax day. Welcome to another edition of the Kansas Association of Counties Zoom webinars in partnership with the COVID Recovery Office. So it's great to see all of you with us this afternoon. If you're like us on the east side of the state, we got some nice rain and thunder this morning, but it's cleared up to be a beautiful day. So for those of you that are still dry, I feel sorry for you, but we've got a little bit of rain on our rain gauge this morning, so we're excited about that. So I want to get started first by saying my name is Bruce Chladny, and the Executive Director for the Kansas Association of Counties, and it's been a pleasure to have all of you join us for these webinars that we've been offering since the pandemic began. I'm sure probably many of you are just like me and have been on every single one of them, and so we appreciate that. And we certainly do appreciate the feedback that you all have been giving us, both in positive response to what we're doing, but also asking good, meaningful questions that we try to get answers to, so that way we can help solve the problems that you all are facing. So with that in mind, please don't hesitate to keep reaching out to us here at the KAC, and we certainly will do everything we can to help you do your jobs to the best of your ability. With that also said, everything that we have currently is now posted to the covid.kansas.gov website, so please make sure you use that. If you would like to go to the KAC website, kansascounties.org, you'll find all sorts of information there as well, and we link over to the COVID recovery site, but the COVID recovery site is the official website, and that's where everything gets posted that you all are going to be using and needing throughout this endeavor. So with that, let's go ahead and get started. Today's webinar will provide updates on the direct aid spending plan template and the reimbursement reporting form. I know that those things were just recently released, and I know a lot of you are working through some of the bugs and some of the issues, and so we're going to address some of that today, as well as the presentations on investment ideas by the Kansas Children's Cabinet and a joint presentation by the Kansas Department of Children and Families and the Kansas Department of Aging and Disability Services. So as with all of these presentations, it is being recorded. We will be able to post that hopefully by the end of today, if not first thing tomorrow morning, and you'll have access to that. And like I've said before in the past, if you're not the right person to be watching this, or if there's other folks that you think need to be seeing these webinars, please don't hesitate to share the link with them. They're free and easy to watch. So with that, Vijay, I am going to turn it over to you and the staff and your guests that you have brought with us this afternoon.
Great, thanks, Bruce, and good afternoon, everybody. I'm going to go ahead and share my screen here and go through a brief presentation with some significant updates that we've made to both of the forms, and then I'll turn it over to our colleagues here at the Children's Cabinet and the Department of Children and Families and the Department of Disability and Aging Services to go through their presentations. So let's begin with the specific presentation from our office. Hopefully everybody can see this. Today we're going to go through some updates from the Office of Recovery and then some specific updates from the direct aid plan, the reimbursement reporting template, and then, like I mentioned, the two presentations. So I want to start by saying that although we're going to go through briefly the changes for those two forms today, we're going to go through them in more detail along with a lot of the frequently asked questions on Friday. So if you don't get your question answered today, I'll just say come back on Friday and we'll go through all of those forms again and the changes in detail. But the Office of Recovery updates first start with something that I know that is on all of your minds, which is getting the funding if you've submitted your resolution. So counties who have submitted their resolutions will receive an email today that their round one allocation has been initiated via direct deposit. So depending on your bank, that may take 2 to 3 days to process. If the funds are not in your account by Monday, you can email recovery@ks.gov and let us know, but that should be in your bank account by Monday, and that is if you have submitted your resolution. We will be sending out an email to notify all the counties who have not submitted their resolutions or have submitted an incomplete resolution. So far, there's only a handful of counties that meet those two criteria, but we'll send out notices by the end of the day today to those counties. And otherwise, you will be receiving an email saying that your direct deposit has been initiated from our office. You'll be receiving the funding in total, your total allocation as has been illustrated in the county toolkit. So watch out for that and let us know if you have any other issues. Additional FAQs, we're still a little bit delayed on this, so we're going to try to post those before the end of the day today, and so watch out for those on the recovery website. But all of the other materials that I'll be going over today, including this presentation, the other presentations, I think we're having a little bit of trouble with one of the presentations, but all of the forms that we're going over today, all of the updated forms, everything should be on the website right now. So you can follow along as we go through them. And finally, round 2 updates, the Spark and the Spark steering and executive committees will meet next week to discuss funding for round 2. So you'll get a better sense of where the state is going to make its investments starting next Monday. So,
hey, Vijay,
yeah.
Can I interrupt for a second? This is Bruce again. Can you give us the time and the dates for that Spark meeting? I know there's one on Monday. Do you know what time that is for everybody to watch if they can?
We'll send it out via email so everybody has
perfect.
that.
All right, thank you. I appreciate it.
Yep. So moving on here, some additional clarifications, some frequently asked questions that we've been getting quite a bit. One is related to public educational institutions, cities that span over multiple counties. Excuse me. As stated in the resolution, the county in which the institution's headquarters is located is the county that's responsible for that institution. So if the school headquarters or the city hall is located in your county, that's who's responsible. But that does not mean that you're the only county that can provide funds at institution. So if you have a school district that's spread across 2 counties, you can share that cost. Or you have a community college or you have some other institution that's spread across multiple counties, you can share the costs with other counties that hold any of the buildings for that institution. Can you submit your direct aid plan or other forms early? Yes, you can submit your direct aid plan early. If you get it done early, once approved, you can begin spending funds. And we're going to find federal guidance. All the guidance we try to post as quickly as possible on our website. But if not, they're on the Treasury website for everybody to see and post the link here. Update to the direct aid plan, and I'm seeing that there's a little bit of issue with the audio, so hopefully that's fine. I'll try to speak a little bit louder. So the direct aid plan, we've made a couple of different changes to the direct aid plan to ensure that the total and most comprehensive information can be illustrated. So I'm going to go to that here in a second, but the new direct aid plan template, which includes the new changes, is going to be on the website. And I'm getting some other chat here that it's difficult to hear me.
Yeah, Vijay, you were breaking up, and I don't know, it wasn't a sound level issue, it was a breaking up issue.
Give me 1 second here. I apologize, everyone. Can everybody hear me a little bit better now?
Yes, if you keep talking, I think you do sound better, Vijay.
Okay, perfect. So again, as I mentioned, the new direct aid plan template is online. And 1 second here, I have to go through both of those specific documents. So the first thing that I want to call out before you all jump into the direct aid plan is, hopefully you can see my screen, but what we did, we put together a memo basically outlining step by step what all the changes that we've made to the direct aid plan and how to fill it out kind of step by step. So we've illustrated all the different aspects of the direct aid plan, but also what you fill out first and maybe some tips on how to fill it out, how to navigate the spreadsheet a little bit easier. So that's on the website. You can read through that just to get some additional clarification. I'll call out here that we did some additional clarification of terms. So what does it mean when we say direct aid? What does it mean when we say transfers? What does it mean when we say programs? So that might clear up some confusion on what do I determine a transfer fee, or what do I determine a reimbursement form fee. So I'm going to go through those forms and those changes really quickly here, and then I'm going to turn it over to our presentation today. So the first thing is the new direct aid template is on the website. The changes that we made are not incredibly substantial. They're just additional fields of information to help you all plan better, but also ensure that all of the specific expenditures are eligible. So I'll go through the changes right now. First, I know there's been a lot of questions specifically about programs and transfers. So what we ended up doing is create a separate tab just for transfers. So if you're doing a transfer to a subrecipient like a school district, you can then go through and create a separate tab just for that transfer, and that subrecipient can illustrate all of their expenditures in an itemized fashion. So if I could provide $400,000 in bulk to a school district to buy a whole host of different things, they just fill out this tab, and so you know exactly what they're spending money on. The second change that we made is that we added a budget narrative section to the program tab, and so this helps you all know what types of positions people plan to hire, what types of contractual services, basically justification for all of the different expenses that you may have. So those are the two major changes. The other changes are just cosmetic. And so what we've done is, instead of saying your total program and transfer, what you can do here is just list out each program and transfer, so you know from a global perspective how much each program or transfer costs and how that figures into your total. And finally, there's been a lot of questions around this specific portion of the tool, which is your monthly spending planning estimations. So this is the date in which you provided funds to that subrecipient, not when they spent the money. So if you're going to provide $400,000 to a school district, you don't need to put when they're going to spend the money. You need to put when the money leaves your bank account. So making that more clear. Again, all of the changes we'll go through in more detail on Friday, but the memo is up and you can read through that, so that's clear. So the county reimbursement form, I just want to go through some of the changes that we made there really quickly. And these are just bug fixes in the spreadsheet. So the first change specifically relates to this expenditure category and subcategory. I know there's been a lot of questions about this hasn't been working for everybody. So I just want to be clear. So you first have to click the expenditure category and then you click the subcategory. And it's showing up weird, it's on Zoom, but sometimes it'll show up as blank, but if you scroll all the way up, it'll show you all of the different subcategories that are associated. If you're confused on and don't want to go through all of the different, if you don't want to go through all of the different expenditures and sub-expenditures, you can just go to the resources expenditure table and you can see how everything is categorized, so you know beforehand before you're dealing with that specific spreadsheet. The other thing that we've gotten questions about is specifically this voice voucher and invoice. So before it was showing up as an amount, right now it should show up as a just a number, and it should be the same on the subrecipient report. And then the expenditure category and subcategory should work the same on the expenditure subrecipient report as well. So those bugs are fixed. And then I just put a note here that the subcategory will only appear if you put in a category. So those are the major changes that we made. Again, you all can digest those through the specific memo, as well as forms that are up on the website right now. And if you have any other questions, please let us know. We'll go through them in more detail on Friday. Finally, I just want to clarify for everybody the difference between the reimbursement reporting form and direct aid planning form. The reimbursement reporting form is the form in which you track reimbursements for the reporting period of March 1st to July 31st. So this is already incurred expenses that you have receipts for that you're going to reimburse subrecipient for or the county for that reporting period. The direct aid planning form is future forward. So it is expenses that you have not already incurred or not reimbursements that you've already planned on giving out, or you've already given out. So the way to think about it is anything that's not in county reimbursement reporting form needs to be reconciled or accounted for in the direct aid planning form. So any money that I am not providing in reimbursements, I can use for whatever purpose I want to use it for, give it to school districts, you do a small business loan program, buy things in the future, but that just needs to be illustrated in the direct aid planning form. And that is illustrated in this slide here, so you all can read through that. And again, we'll go through this in more detail on Friday. I know I'm going through it kind of quickly. So the next thing that we're going to do is go through the presentation from the Kansas Children's Cabinet. I'm going to pull it up here on my screen, but we have Melissa Rooker, who's the Executive Director of the Kansas Children's Cabinet, here to present on childcare related investments. And while she's doing that, we'll have other staff from our office on the chat to answer any questions. And Melissa has staff members from her team ready to answer questions as well. So I'm going to go ahead and pull up the slideshow, and Melissa, I'll turn it over to you.
Thank you, Vijay. I appreciate that you will be operating that PowerPoint for me. I'll just indicate when it's time to change slides. You can advance to the first slide in our deck. My name is Melissa Rooker. I am the Executive Director of the Kansas Children's Cabinet and Trust Fund. And my first job here is to orient you to the work that we've spent the last year and a half doing, which sets up the basis for the recommendations that we're going to be making for you to take into consideration. Basically, the Children's Cabinet was part of a collaboration with the Kansas Department of Education, the Kansas Department of Children and Families, and the Kansas Department of Health and Environment to conduct a very comprehensive statewide needs assessment in 2019. So we have established the baseline need for childcare and education across the state of Kansas prior to the COVID crisis. And now that we're dealing with this public health situation that has put incredible stress on the system, we know these problems are amplified. The slide that is in front of you is basically that year's worth of work in one slide. There are two central messages from the work that we did to gather information across the state. And we did have over 6,000 stakeholder voices that contributed to the information, as well as existing needs assessment and data from 45 different sources. So we feel good about the level of work that went into this. Number one, the experience of families across the state raising young children is shaped by where they live. Aside from the obvious rural versus Johnson County or urban core kinds of differences, there are differences in the specific communities. It really does affect the access that families have to services where they specifically live in their community. And the second central message is that we have too many young children in the state who are growing up in families where their basic needs are not being met. So it becomes very difficult for a family to focus on high quality early childhood resources when they are really just struggling with the most basic needs, shelter, food, transportation, healthcare. And COVID has amplified and raised the pressure on families all the more. The key findings in our needs assessment are broken into the categories that you see on the right of the screen. The key findings are categorized as problems with accessibility, families actually connecting and accessing services that do exist, coupled with a lack of availability of services, so just not enough slots for the children that need care, or services not being available in a given community, that kind of thing. Navigating the system is a significant core of the problems, that we leave families to connect the dots for themselves and really are not working to make it more seamless for families to transition from one service to another as their kids age out of a given program, or begin to need new and different services. Collaboration is another chapter in the needs assessment. It's not lack of will. There's intense interest among programs to collaborate better with each other, but the scarcity of funding makes that collaboration very difficult because they are all competing in a very small space for available funds. We have issues with the early childhood workforce, predating COVID, but exacerbated by COVID. And so we need better wages, we need better training and education opportunities. We need to make this a field that more people are willing to go into, because our workforce is aging out into retirement and we don't have enough young people stepping into the void to keep things moving. We have facilities issues that, again, predate COVID, and now we're asking facilities to follow public health guidelines and open up safely to care for children. And there are significant physical changes that particular settings may need to make. And add that to scarcity of space for programs to open and different requirements of being a licensed facility, and very little available funding to do capital improvements. And then the systems alignment piece is really speaking to better alignment within the governmental agencies involved and breaking down silos that exist and making things easier to navigate. We also, for the sake of the needs assessment, highlighted bright spots across the state happening in communities so that we could remind ourselves that we really do have a commitment to providing the best possible start for our kids, but we didn't want that message to get lost. So we've tried to lift up good things that are happening. BJ, if you could advance to the next slide. So we've come up with a set of recommendations that are somewhat high level, and I am happy to engage in specific conversations with any of you if I can be helpful. But the first slide really speaks to some things that we're encouraging you to keep in mind as you are putting your plans in place, that are not part of how you spend the dollars, but that are more about how you decide to spend the dollars. So it's really important that the voice of parents and providers are part of your decision-making process. So as I know that there are some communities that already have local task forces that they've put in place to deal with the CARES Act funding, business roundtables and different economic development agencies that exist. There is work that exists, and there's work that you're probably needing to engage in. Our ask is that you reach out and include some representatives of the childcare community and even parent voice, so that your decisions are anchored in things that can help them better deliver the services that are needed and address the challenges. And the other one is that an intentional effort to classify childcare as essential will help our providers as they grapple with the need to procure the supplies that are necessary to safely open and operate. And so we know that without adequate childcare, businesses are not going to be able to bring employees back on, and we can't have growth and stability. So making sure that as you create your protocols for the essential workers, that childcare is on that list. BJ, you can advance. All right, so on that issue of procurement, our work this spring throughout the crisis has been to listen to providers across the community. We do bi-weekly webinars and that are very interactive. We take input from the providers that join us. We have done surveys, and we are using our story gathering tool, which is called Our Tomorrows, to gather stories from across the state. And so far we've heard from people spread across about half of our Kansas counties. Procuring supplies is a problem, and we are hopeful that there is a way to open up channels for childcare providers to access the PPE, the cleaning supplies, and special equipment, things like contactless thermometers, etc. All of those things that we know public health guidelines suggest need to be used to operate safely. Even food to meet childhood nutrition guidelines. Our providers at times in areas around the state during this crisis have been suffering from the supply chain issues that everybody is dealing with. It's mainly because most of them are licensed to operate in-home childcare rather than being a big corporate childcare center, and they don't have access to a supply chain that can help them. So they're at the mercy of what's on the shelves at their local grocer, or even in the big box stores, or online on vendors like Amazon. A lot of those supplies have been set aside as priority for the essential workers. We've done some work to find out what is happening around the country. There is a way that, like, if you could officially designate childcare as essential and provide some sort of documentation of that designation, then we think that that would help them if they were to try and order from an online vendor that has a priority section for frontline workplaces. If they're given such a formal designation, that can help. The other thing is maybe there is a way the public health department or the local unified school district or some version of the local governmental structure can help connect them to the type of vendors that could help them place orders. Even a local retail store manager could help with a standing order, or some sort of process for helping prioritize the supplies that our childcare workforce needs to protect our kids. Can we go to the next slide? Childcare facilities are in need of some significant and specific types of upgrades to operate and stay open safely and meet the public health guidelines. It can be anything from altering the entryway so that drop-off is done in a way that keeps as much separation as possible between, if more than one family shows up at the same time. They need a way to manage the drop-off process, and some of our facilities need to make some physical alterations. It might be adding hand washing stations, or upgrading an outdoor space to expand the ability to operate in the outdoors and in weather that's conducive. It could be additional furniture or other types of materials to make sure that kids can be spread out and separated. It could be entering into agreements with other local types of facilities. It could be churches, it could be community centers, to expand the physical space so that we can maintain social distance with smaller groups of kids. All of those things comply with the guidance in the CARE Act, and we are urging thought given to providing a program where you grant funds to be able to make these upgrades. It could be as simple as making sure that there are enough toys and art supplies and the kinds of materials that normally might be stored in a communal bin, but now we want every child to have their own set, so they're not trading those supplies with each other and share and passing the virus along. So those are some examples of the kinds of physical upgrades that might be part of a grant program that you offer. We can go to the next slide. And I know we're not alone in making this ask of you. I know there's a lot of attention to the actual connection to the internet and expanding access to broadband service. What I want to remind you of is that many of the families that we support through our programs are at income levels where they don't have the basic equipment on their end to connect, even if that internet service is available. So think in terms of the subscriber fees for this period of time, the funds can cover tablets or computers or cell phones, whatever type of hardware. If you don't already have good access to broadband, perhaps even we've seen innovation with bringing individual mobile hotspots so families can connect. This will allow the providers in your community to continue providing service through home visits that are virtual and connect kids to teachers in the classroom and make sure that providers and families can stay connected. So this might be done in partnership with Area United Way agency or Head Start program or school district or any number of childcare providers. I'm going to throw out some names and they aren't prepared, but I know Russell Child Development Center or Greenbush or Family Resource Center or the Family Conservative. There are places around the state, Livewell, Kansas. There are hubs that might be helpful in connecting the families and the equipment that they need. So that's another big item on our wish list. We are seeing trouble with non-traditional childcare service hours. So this would be some intentional work with providers in your community to expand service hours. And we're recommending that you think about creating a bank of funds that can be used to draw down for emergency childcare and help pay providers for their service. Because, as employers look for creative ways to spread their workforce around and not have a high concentration in the building at any given time, the need for non-traditional service hours is expanding, and it would be helpful if there were a way that communities could support that need. And then finally, one that's going to be difficult for me to summarize in the brief amount of time I have, but is part of creating a hub that will allow for seamless referrals to services and transitions between programs, is a program in place in a number of communities around the state that we call IRIS, which stands for Integrated Referral and Intake System. We can provide the technical assistance to onboard a community to become an IRIS community, and we would probably recommend working through the public health department in your county, where we could bring together the community of providers that serve children and families in your area, in your county, and get them onboarded into this referral system. And what it means is that for a family, there would be no wrong door. So if someone is dealing with a very sudden need driven by COVID, both parents are sick and suddenly there needs to be a plan for how to care for their children. Somebody has lost their home because they've can't pay their rent and they need some housing supports. No matter what agency or provider that family ends up connecting with, IRIS allows that provider to input a referral that this family needs other types of services, and those referral notices go out. The provider making the referral knows when the referral is received, and then they get an email that says the connection was made with the family. What we're seeing in communities that have adopted this program is a much higher success rate in getting families connected to services. And what we're seeing in our story bank is families are struggling with food insecurity, housing insecurity, healthcare issues, all sorts of access and and new and different issues that are driven by the very sudden change that COVID has caused, and they don't know where to turn. So providing a network that your community is dialed into that would help make those referrals run more quickly and more smoothly is part of our larger goal for the early childhood system in the state. You can find on our website, I think the next slide has our contact information. Vijay, can you advance? So this is our website. The share form that is in this link is a way that you can contact us directly through the website. And I've offered my email so you could come straight to me via email as well. All of our information from the needs assessment is on the website. We have now drafted this spring, we completed a 5-year strategic plan for early childhood. There are things in it that you at the county level could be active participants in that would help us move the system in the right direction. Even through the crisis, there is opportunity to make strides. And so I welcome your questions, I welcome your outreach, and I would be happy to have more specific conversations with any of you at the appropriate time. Thank you.
Thanks, Melissa. And again, these presentations are a resource for all of you. So please reach out to the presenters if you have any additional questions. And I want to underscore that today's presentations are specifically a great way that counties can support some critical services for reopening. And you've just heard about childcare, you'll hear about human services more broadly. But right before we jump into the presentation from GCF and KDADS, I know it's been on the chat, so I just want to call out, and hopefully everyone can see my screen. If you go to County Resources and Guidance on the covid.ks.gov website, the direct aid form, the memo is here. And if you want to see the webinar information, you just click on webinars, and all of the presentations are here under July 15th. So I'm going to stop sharing my screen here, and I'm going to turn it over to Megan Dodge, who's the Deputy Secretary at the Department of Children and Families, and her team to go over a presentation regarding human services investments. And I want to thank them for their time, and I'll turn it over right now.
Thanks, Vijay. Hi, everybody. I'm Megan Dodge. Like he said, I'm Deputy Secretary for Operations for Department for Children and Families, otherwise known as DCF. And I believe Scott Bruner is also on. He's the Deputy Secretary at KDADS, the Kansas Department for Aging and Disability Services. He'll, I believe, be sharing our slides, and I'll be kicking it off. So here he goes. Ethan Belshie from DCF, he'll be on monitoring the chat, and maybe we can have a few minutes at the end to kind of highlight some of the themes of questions that have been coming in through the chat. So we want to thank you for your time and know that this has been a process, and just really appreciate the opportunity to share with you some ideas that our teams have around ways that counties can invest in human service areas with these funds. So just a quick overview. We'll be, of course, just reviewing some of the focus areas that have already been provided to counties to brainstorm some ideas on areas for county investments. We'll be focusing more specifically on human services in 4 broad categories of connectivity, housing, food, and childcare. And so within each of those, we'll be talking about some existing resources and also be highlighting some partnerships. We know that you all already have great partnerships within your communities, and we want to acknowledge that, but then also acknowledge that maybe there are some new partnerships that can be made with some organizations that we'll mention. And that's just an opportunity to, potentially invest in programs that are already ongoing, or to work with partners in developing new ones. So within each of those 4 categories, we'll also be sharing some ideas for investment that counties can consider in spending these funds. I think there are a lot of really great resources out there. We'll be highlighting some of those, whether they're governmental or nonprofit. But the question is, how can counties kind of help fill in those gaps and think about ways that we can strategically invest these funds. Also just want to highlight the important role that human services can play in supporting, as we continue to reopen local economies. At the end, we'll talk about an idea we have around how we can provide service navigation for Kansans as they try to navigate what resources might be available to them during this time. So on the next slide, this is a slide like you've seen before, and it's just the investment ideas that have been provided to counties. And just want to highlight that within those, we'll be highlighting some of the human services ones. So for example, under economic development, homeless services for homeless populations or food distribution and inventory. Also be highlighting telehealth, which is listed under here under connectivity. So moving on to our first category, I'm going to hand it over to Scott Bruner at KDADS.
Yeah, thanks, Megan. This is Scott Bruner. I'm the Deputy Secretary for Hospitals and Facilities at the Department of Aging and Disability Services. We've been working very closely with our colleagues at DCF on kind of the broad range of human service programs. So these aren't necessarily all disability related or aging related services that I'm going to talk about, but we divided up the slides to be a little bit equitable, and they do overlap quite a bit. So hopefully you'll see that as well. Like Megan was saying, we wanted to focus on kind of some of those themes that you've already seen and kind of where we've already been doing some work, or where there's COVID related spending that is a good jumping off place. So on the connectivity track, we've had a couple of things that we've been working on with, particularly at KDADS, on telehealth around mental and behavioral health services. Because of COVID, the federal government's relaxed some of the restrictions on using telemedicine in mental health and behavioral health settings. We've been doing that primarily through the Medicaid program and working with community mental health centers quite extensively, but also substance abuse providers and private behavioral health practitioners. But that's a technology that's useful and made it possible for, even though facilities are closed or had to close for at least some length of time, they were still able to offer active treatment to folks that were able to connect over the telemedicine. And then the other example that we've got here is federal approval for nursing facilities to purchase tablets. The federal government let us use some money that we collect from penalties and fines to give grants to nursing homes to buy tablets so that residents could communicate with their family members and loved ones through virtual visits. And through that program, it was a limit of $3,000 per facility, but so far we've bought, or through that program, had purchased 900 devices and over 200 nursing facilities around the state to really leverage when you can't go into the nursing home themselves, but you could have a visit over a virtual space. So using those kind of existing ideas that we've already got, we try to think of how could county investment kind of add to those capabilities. There's certainly probably some investment in telehealth that maybe through your local health department to do more telemedicine type visits, or even like WIC visits remotely. That would be a possibility. We wanted to call out investing in your local mental health center or the mental health center that your county supports to make sure that they can stay connected, that's a robust technology to help people connect to a wide variety of services. You think about a one-on-one appointment that migrates pretty quickly to a telehealth setting, but if you think about group therapy or family therapy, that requires maybe more devices or more connectivity. So there's certainly some areas where there could be some investment there. And then the last one there in that center column, tablets. I mean, we were able to use the federal authority for nursing facilities, but it left a gap in assisted living settings, home plus type settings, group homes where there are multiple people with disabilities living in the same area. Translate that into senior living communities where they maybe got a congregate meal site, but everybody lives in their own apartment. So there are some of those kind of settings where that same, maybe it's not so much that the family members can't visit their loved one, but maybe they're removed, they're in a different state. So investing in that technology and capability to connect people is really an important part across settings, not just the nursing facilities where we were focused. We tried to list some of the partners there for your reference, just to give you ideas of people to talk to and ask about. I think we've mentioned most of them. Independent Living Centers for Independent Living are great resources to get across the disability community for technology and resources and capabilities. And we listed the CDDOs there for people that have developmental disabilities as well. But again, those are just ideas that leverage existing activities and fit into that theme. Housing is another one that we talked about, and we've got some federal funds for supported housing, primarily for people that are homeless or potentially homeless that have a mental illness. Your mental health centers are kind of the gatekeeper for those services and programs, but that's there through KDADS. And then on the DCF side, cash assistance can be used to cover housing expenses, at least a portion of housing costs. The benefit, the cash assistance benefit, is pretty small. It's $100 or $111 per person per month, and eligibility is fairly restricted. But it is a place where there's money, federal money in the mix to support housing, and so we wanted to call those things out. Again, as you expand the circle a little bit for counties, the DCF program or through TANF, and even the mental health related program, I mean, that helps people that are pretty low on the income scale, but there's a lot of people at the next tier of income where may have struggles paying their rent, paying their mortgage, and the federal protections and state protections are going to run out. So there may be a seam there to fill in between the lowest income families and more moderate income families to provide some rental assistance. Investing in homeless prevention programs. I talked about the housing program we do. Housing First is another initiative that's around the country and in Kansas that really focus on getting people into homes before they enter treatment for other kinds of substance abuse or mental illness. That's an area that could certainly use more investment. And then senior housing as well, just making sure there's an adequate supply, not just of institutions, but independent housing for seniors that have support or services that are available. So those are areas where counties might want to think about, and we listed again the partners there. Community action agencies have a lot of interest in this area, are doing a lot with foundations and housing authorities to kind of bring funding streams together. So in most communities, you wouldn't be starting from scratch. There are lots of willing partners to engage in those activities. So that's connectivity and housing from my perspective. I'll come back and talk a little bit more about about navigation when we get to that slide. But Megan, you want to take the next two?
Yeah, thanks, Scott. All right, so moving on to food security as the third category that we looked at. To highlight a few of the existing resources that are out there, of course, we have the KDAD Senior Nutrition Program, which provides nutrition meals to seniors over the age of 60 through the Older Americans Act. And there's a phone number on this slide here for individuals to be able to contact and access these meals by calling the Aging and Disability Resource Center there. The second existing resource to highlight is what we call TFAP, the Emergency Food Assistance Program, and then also the Commodity Supplemental Food Program. So TFAP provides free food to low-income households, and we work with partner organizations to distribute those foods. And then the Commodity Supplemental Food Program is something that delivers monthly food packages to people who are over 60 and qualify with an income less than 130% of the federal poverty level, which is about $34,000 for a family of four. Moving on to the next slide. So DCF also administers the Supplemental Nutrition Assistance Program, otherwise known as SNAP and formerly known as food stamps. So this is a program that provides qualifying low-income households with benefits just to buy food. Now, beginning in March, federal legislation allowed us to increase this monthly benefit to the maximum allowed amount for families regardless of income. So if they're qualified, then they can get, during this pandemic time, they can get that maximum benefit. So right now that amount, as for an example, is for a family of four is $646, and That's approved through July, and we'll continue to look at getting federal approval for that. During, before this time and before this maximum benefit, the average SNAP benefit was about $115 per person per month. Something that we've also put in place during this time has been pandemic EBT. It's a one-time benefit that families can receive if they have children who are in school and had access to either free or reduced lunch, but might not have access to it anymore with school closures. That's still open, and I believe the deadline to apply is at the end of this month. Moving on, we are working with the federal government, with the USDA, to offer an online EBT program, which will allow Kansans to use their EBT card and do online shopping. So we're looking at kicking that off in September, and we'll touch back up on that on the slide here. So in thinking about ways that counties can invest and support food security during this time, we looked at, of course, supporting and investing in local food pantries or other organizations that are in your communities and fighting food insecurity issues. Also looking at funds for food distribution and inventory. Also, I think we've seen some creative examples in different communities of where local restaurants have stepped in to help kind of fill the gap and meet food needs. And so maybe looking at partnering with local restaurants to see where that, where those opportunities might be. And then also there might be interest within your community for local grocers to participate in that online EBT program that I mentioned on the last slide. And so, if you have someone that's interested in participating in that, we're happy to help make that connection and see what the possibility there might be. In thinking about potential partners, we acknowledge that a lot of you have these partners and might work in this area, but of course, food pantries, local economy with the restaurants and grocers, community action agencies, and local community foundations are all doing work in this field. Okay, moving on to childcare. So just to highlight some existing resources, we administer the Childcare Assistance Program. This is a subsidy that provides eligible families to help pay for childcare costs. Generally, if a family has an income under 180% of the federal poverty level and has a child or children under age 13 and are in need of assistance with childcare costs, then this is where the program can really come in handy. So the average monthly benefit was about $470 per child. Something that we've done during this time, we've created the Hero Relief Program, and there's a link to a lot of these resources on the last slide of our PowerPoint today. The Hero Relief Program extended this childcare assistance program to essential workers that continue to work during the pandemic in areas like medical, healthcare and essential medical staff, first responders, National Guard. The website has a lot more information. And so we just wanted to highlight that as something that I think continues to be a benefit to various people in the communities. Within that, and this is on the website too, there are various grants available to childcare providers to help them kind of get through this time and help try to sustain the availability of childcare in Kansas. So in building on that and thinking about suggestions for county spending, I think the Children's Cabinet really covered this, and so I'm not going to spend too much time here, but really it's about thinking about how we can support our local employees and employers in meeting their childcare needs. Whether it's additional investments in grants for our local childcare providers to meet those enhanced health and safety requirements, investing in alternative options to provide that flexibility that we know employees are going to continue to need, ways that we can support childcare workers such as additional training, and then maybe looking at, and we're happy to talk with you about ideas, but looking at additional childcare subsidies for workers that might not be covered by the Hero Relief Program that I just mentioned. Potential partners in this area are Childcare Aware is an organization that does work in this field. Wanted to highlight what Melissa was saying about the Our Tomorrow project and how that could serve as a resource to counties. And then also childcare providers that might be able to step in, you know, and provide that after school care or just flexibility. And so looking at maybe other, you know, maybe non-traditional ways to provide childcare during this time. So moving on to kind of the last section of our presentation. So together with KDADS, we were thinking about how important it is right now to have maybe a one-stop shop for Kansans to come and understand about all the resources, whether it's governmental or nonprofit, that are available to them during this time. And so we acknowledge that this service might already be out there in some counties, and so maybe it's about kind of investing additional resources in that or standing up maybe a new service. And so I'm going to pass it over to Scott to close out on this slide.
Yeah, just a couple of other thoughts from our perspective. We use the word navigation here. It's really meant to be a resource for people that are maybe new, you know, if they're new to the system, I guess, or human services, they've never interacted with or had a need for food assistance or childcare assistance. You know, that can be kind of a daunting thing to step through the door and make an application. So having somebody there that they can trust, that's a navigator, that knows the resources, knows the questions that are going to be asked and how to answer them, is a pretty meaningful thing. The other term that you could use if navigation seems too restrictive or has some other meanings to it is a connector, just somebody that can work with people who are applying, coming with issues or questions, and connect them to resources that are available either at the state level that we've talked about, federal level that we've talked about, or even at the county level. That's a really valuable part of people accessing all the services and benefits that they need, and also that they're eligible for in a lot of those cases. Maybe the other value of this as an idea or thought is you can connect people to the service that they need directly, the one that meets their immediate need, but identify some other needs that they may have or other resources that are available. So if somebody comes in and says, I lost my job, I don't have health insurance anymore, I need help applying for Medicaid for my children. But at the same time, you could say, well, have you thought about, if you've lost your job, maybe you need to get connected to the workforce center and find something, or maybe can help you with some childcare or retraining. That's the kind of scale of the navigation or connection service that we're talking about. You have to know a lot about kind of the state level programs, but you've also got to know your community, which is why we're suggesting it to all of you as a county level role. So we've listed Megan's name and email address and my name and email address. If you've got questions or issues. We also put on the last slide, if I can advance to it, some resources for some of the programs that we talked about to look at if you need some additional information. But Megan and I are both available if you have a question that you don't want to go hunt around on the internet for, which we all spend way too much time doing anyway. So if having a personal connection, we're happy to offer that as well. I did see one question on the chat that I would like to answer, if that's okay with the moderators, or if that's appropriate now, or happy to wait and see what the next step is.
Go ahead, Scott.
So there's a question about, I don't see how most of the projects presented in this Zoom can even be started in the time frame we have to work with, much less completed by December 30th. I don't know if that was specific to the KDADS and DCF presentation, but it's a good question. We did think about that quite a bit. You know, some of the suggestions that we made are maybe a little longer term, the housing kinds of things. If you're wanting to build, you know, a 40-unit senior housing facility, that probably can't get all spent and built by December. But some of the technology parts, the investment in existing partners and childcare, that is something that I think is more immediate. The infrastructure is already there. So we did try to present a range, knowing that would be a concern, but also give you some things that are more practical. So hopefully there's a mix.
Well, and this is Melissa. I'll pop in and echo the sentiment that we actually have experience moving funds to our childcare community and families very rapidly as we dealt with the crisis and incredible need that was suddenly thrust upon everybody. We actually were able to get some things set up. So there are ways that we can be very helpful, and that's where I would encourage you to reach out directly to us if you have thoughts about things you'd like to do, but can't for the life of you figure out what, where that starting point is. Trust me when I tell you that both with DCF and with the Children's Cabinet, we have already thought these things through and can help you get connected to things that exist. The IRIS referral network exists. For $25,000, your county can get the technical assistance to onboard it, and then we can help with the technical assistance to keep that moving. So we've been very intentional about trying to put ideas in front of you that we do think would help between now and December, and not be something that is longer term than that.
Yes, I agree. We hope to serve as a resource moving forward, so feel free to reach out.
Awesome. Thanks, Megan. Thanks, Scott. Thanks, Melissa. Last thing, we'll just quickly go through next steps here before we end today. So continue to review the changes to the direct aid form. That is, unless there's any bug fixes or anything like that needs to be done, those forms, those are as comprehensive as we can make them. So, and review the memo as well. Friday's webinar will be directly just going through those forms in more detail and ensuring that the questions around those forms are answered. So watch out for that on Friday. I apologize for the issues with sound today. Continue to organize and collect your reimbursements. The Spark Steering Committee is going to be on Monday at 1 p.m. via the governor's YouTube page. All the materials will be posted online. I know there's been a lot of questions around what is the state going to invest in round 2. All of the proposals that are up for funding at the state level will be illustrated and explained and approved and at least initially reviewed on Monday. So, and then on the next couple of days, the executive committee will meet and do a final approval. So you'll have a good idea and be able to actually see those starting on Monday for connectivity, for health, for economic development, and for education. Finally, I want to say, again, the next webinar is the 17th. If you have any other questions, please continue to let us know. We're monitoring the chat and we'll try to update the FAQs as quickly as possible here and go through these spreadsheets in more detail on Friday. And I want to just say, I appreciate everyone's patience. I know this has been a difficult process. I know it's been a frustrating process, but I just wanted to say thank you for your patience, and we will continue to get all the resources that you need to you as quickly as we can, and continue to update things and continue to be better about all the specific needs that you have. So continue to use the avenues that are available, and I'll turn it over to Bruce here, but we'll see you on Friday.
Awesome. Thanks, Vijay. And also Melissa and Megan and Scott, thank you as well for giving us some fantastic suggestions. And I echo your sentiments about, is this actually doable? And really, it's not meant to be done all by one individual. It's meant to be done by a whole community. And so the key is to bring partners in, bring some folks to the table, and help ask for some questions and help get some answers and that sort of thing, because it's a very, very heavy lift on your own. But if you bring in some partners and support, you definitely can at least get something done. It doesn't have to be everything, this whole list. I mean, it's not all doable, but certainly pick one or two important things that would make a big difference in your own community, and start it and see what happens. So I'm sure you guys will accomplish some great things as we get into this. There was a question about the MOU. Jay, myself, actually more so Jay, had put together an MOU that you all can use with other organizations within your community. It's very similar to the one that was created to be a partnership with cities. We tried to make this one a little bit more flexible so that you can share it with other nonprofit organizations, businesses, and school districts and whatnot in your communities. So that is actually posted on our website. Kim Qualls just went ahead and posted that for you. So if you go to kansascounties.org, you'll find that there. You can download it. It's a Word document just like the one that you did with the state, and you can go ahead and change and fill in what you need to fill in, and then share that with other partners around the community that you're going to be sharing money with. And then finally, I know that the frequently asked questions keeps coming up, and I know that Vijay and the rest of the recovery office are working hard to get those done, and we'll definitely make those available to you as soon as we can get those put together. And then, like I said, the recording for this event just now, once it becomes available in the next, hopefully, couple of hours, we'll have that posted as well so you can watch it again. So until next time, folks, have a great rest of the day today, and we look forward to seeing all of you again on Friday. So take care and have a wonderful afternoon.